Hey everybody, Dr. Rob here, Facebook Live. Hope all is well with everybody. Please do me a favor, if you like what you see, share it. Share your friends. I'm talking about lower back pain. I'm talking about disc injuries. I'm going to explain what it is, what the vernacular is, what the lexicon is, if you will, of lower back and disc. 8 out of 10 Americans have, at some point in their life, lower back pain. You want to share this. You know, John's over there. He's holding up a couple of phones for me. You know, great guy, Silverback Social. And I always ask him, you know, lower back or something. And he looks at me and he's a real pragmatic. He goes, everybody's got lower back pain. So if you got something to talk, let's talk about lower back pain. So 8 out of 10 Americans at some point in their life have lower back pain. It is a $765 billion industry. Remember, we talked about it just a couple of weeks ago. New information came out. No pain opiates. No epidurals. Only take non-steroid anti-inflammatories, Aleve, Advil, ibuprofen, after trying conservative treatment. Some of the best treatments you can try are spinal manipulation, acupuncture, exercise with motor control, low-level laser, Tai Chi and yoga, flexibility. So in my office here at 311 North Street, we use all those different modalities to get an outstanding clinical outcome. Something that was missing that we're going to go over today also is the nutritional component. With all that being said, you get a lower back injury and people come to me and they go, because remember, I treat patients like all you every day. I got a slip disc. There's no such thing. There is no such thing. Let's go through some of the more basic terms. Regular, healthy disc. Bulging disc, herniated, protruded, and extruded. Herniated and protruded are virtually the same thing, but let's back up a little bit. Here's your disc, right there. There's your nucleus. It's your centerpiece. This concentric rings on the outside is your annulus. Nucleus, annulus. So when you look at this annulus, only the outer third has a nerve ending. So you can push into that area and nobody can feel pain. 1/3 of Americans have a herniated disc without discomfort. Behind the disc, in the posterior, the back part, is your spinal cord. Right there, posterior, back, spinal cord. And the cord, which is here, left and right, you got a nerve root. So with that being said, healthy disc. Here's your bulging disc. It's a little pull in the nucleus. And the nucleus pushes into the annulus. If it's not bulging too much, you may never, ever, ever feel pain. That's a bulge. It's kind of like a little bit of a flat tire if you think of the disc as a tire. I always like to tell everybody, think of the disc as a jelly donut. The jelly inside being the nucleus. Little bit starting to squeeze out. It's bulging out. This is herniated or protruded. Let's keep the word herniated. It's ripped out. Look how it's ripped. You see that material out here? Typically posterior and lateral to one side. There's your herniation. This is a little different because the herniation, in theory, can press either on a nerve, like this guy. Now, if you have pressure, direct pressure on a nerve, it will hurt like the bejeevers. Oh, I got pressure, I got a pinched nerve. Believe me, if you're pressing on a nerve in your lower back or like your sciatic nerve, anybody ever have a toothache? The sciatic nerve is considerably bigger than that nerve. You would really almost be bedridden. So you're probably not getting direct pressure. What you are typically getting is, with this herniation, a leaking of this material. Now, before I go any further, it's pretty hard sounding, the model. The interesting thing is it's jelly. So think of your disc like jello. The only difference is it's not hard frozen jello. It's like jello that was left outside of the refrigerator and it's soft. It's almost fluid-like. So when you do that, that fluid leaks out. It causes a chemical irritant to not only the area, the local area, but to the nerve. So that irritation, the disc material is irritating it. So let me explain what's happened. Your body's not supposed to get exposure to nucleus material. When the body has exposure to nucleus material, your body has an inflammatory reaction. It actually has what we call an autoimmune reaction, which elevates inflammation in the local area. That inflammation in that local area, in that joint area, leads you down the road to arthritis. Arthritis is not wear and tear. It's the body's improper response to inflammation. Now, in addition, because this is inflamed and it's autoimmune, osteoarthritis is autoimmunity. Wow. So imagine all those gut talks that I gave before, where I said you got to fix your gut so you don't have systemic inflammation. Think of that direct tie-in. So people come in, I got a disc herniation, Dr. Rob, you also want to fix my gut other than treat my back? Yes. I want to treat you. I don't treat symptoms, I treat systems. In any case, coming back to the disc, this material is leaked out. It's in the local area and you're having an inflammatory reaction, and you're also having a systemic autoimmune reaction. So when people say I have a herniated disc and I want to rest, that makes no sense. You want to make sure that you can, one, heal the area. In addition, try and get the disc material back in there. Now, there's one more small caveat. Interestingly enough, most herniations occur posterior back and lateral. That's where those nerves are. So if you don't get that material back, the material, the nucleus material, the disc material will lay on the nerve, and then you get that localized lower back pain. Yeah, I got a couple of herniated discs. It's not going down my leg, but it's localized. It's localized because the material is exposed in that very local area. The disc in the outer third has its own nerves. So let's go over this. Healthy disc, bulging disc, herniated protruding disc. Extruded would mean it broke away and it's floating. Believe it or not, breaking away and floating has a better clinical outcome than herniated. If you go to any doctor, doesn't matter, chiropractor, physical therapist, orthopedist, primary care, they need to explain this to you. If you don't understand this, you're really not going to be able to understand the treatment protocol. In addition, once your disc is injured and you lost the material, the ergonomics of your spine are differently. You're going to move differently. Your spine isn't the same. And if you don't address it and strengthen things around it, we're going to get to treatment. You're going to start herniating other discs in the local area. You're going to have a biomechanical fault. Think of your tires. What happens if there's a little air or loss of air in one of the tires? That tire is going to wear away quicker, but the other tires are going to be also because they're imbalanced. Think of your spine as the same way. It's a perfectly connected or interconnected organism with everything. So, once again, normal disc, bulging disc, herniated disc, and some other models that I used. Let's get to the overall view of the spine right here. Let's take a look at Romeo. He's a good-looking guy. Nevertheless, there's your lumbar spine and there's your herniated disc. You've got all this mesentery in here, but you've got some specific muscles that are going to negatively or positively affect your spinal health. There's your psoas. Your psoas, look at it. Look where it is. It's right in your stomach area, if you will, your abdomen, your anterior abdomen. It's right here because it goes from T12 to L5, not touching the L5 disc, also touching what? Your sacrum, your pelvis, and going, that's your femur, going to your leg, going to an extremity. It's a truly long muscle. It's anterior. So when people do sit-ups, they're actually working their psoas. Oh, I feel it here. But when they do a sit-up, they're bending their lumbar spine. If I put you in a plank, you're not bending your lumbar spine, you're holding it in place so your core gets tight and provides protection to your spinal region. So sit-ups don't work. How about a leg raise? When you go like this, you're bending at your lumbar spine, but you're also working your psoas. When your psoas gets activated, it gets tight and presses down on your spine, providing pressure, bringing your pelvis forward and out, locking on your joints. So most people with lower back pain have a tight hip flexor psoas. Most people think the hip flexor is here. They're not incorrect. It's just a small piece affecting your femur. This is your psoas, this is your iliacus right here. Together they make your iliopsoas. So you can really see the effect it has on your pelvis. Psoas, iliacus, iliopsoas. The problem is when this is tight, it's not here, but my hands are the muscle. Your glutes are right here, they get weak. And when your glutes get weak, look what happens to your sacrum. Look at those nerves. Do you see that getting pulled? Do you see that getting pulled? Your glutes shut off. It's called neurogenic inhibition. Anyway, it shuts off. Some of the biggest problems that people have is that everybody suffers from weak glutes. If you don't believe me, watch people try and stand up. They need to use their hands to stand up. They can't just pop up. Ask them to squat. That's why movement screens, my functional movement assessment is great, because it really looks at glute power, or if glute is shut off. So if your psoas is tight or super engaged, your glutes are shut off, you have what we call anterior pelvic tilt and lower cross syndrome, because your core is going to be shut off right here and your low back is going to be tight. Lower cross. Anybody have any more questions, come to one of my seminars or ask me. Now that we talked about core, let's go through it. There are intrinsic muscles in here in your core that enable your spine to hold. They're stability muscles. They're called local muscles. You get them from holding a brace. The core is not supposed to move because you want your spine intact so everything else can move. If your spine's not intact, it breaks, it moves, and look what's happening. You want your spine to hold intact so you can move your legs and you can move your arms. So what you want to do is you want to do front planks, you want to do side planks, you want to do stir the pots, you want to do things to enable your core to hold tight, those local muscles. Then as you go out a little further, you have global muscles, they enable you to move. So core activation, if you come into my office, is a key component for lower back pain. Movement assessment, orthopedic assessment, a key component if you come into my office for lower back pain. Differential diagnosis. Is it muscle? Is it nerve? Is it structural disc? Differential diagnosis is a big thing. What treatment protocols do I like? Well, number one, spinal manipulation has its place. Get spinal manipulation when needed and when assessed by a chiropractor. Nobody does it better, without question. Nobody does it better. It's a great item if needed. It helps with mechanoreceptors and the like. In addition to spinal manipulation, traction and spinal decompression, used properly on a flexion distraction machine, works great. It provides, maybe this one's a little bit, well, here we go. Here's your spinal decompression. It opens up the spinal, I'm having a little trouble here. It opens up the spinal region, and by opening up the spinal region, you get nutrition via inhibition. That's the only way you get nutrition into the disc. In addition, we talked about muscle problems. So muscle problems, muscles become tendons, they insert on joints and bones. They are key elements. So typically muscle problems are from muscle imbalances. Some are weak, some are tight, some are lengthened. So you need a great assessment. How do you change these muscles? Number one, active release. Active release technique is a great technique. It's a patented soft tissue technique. I'm certified for the last 15 years in it. Active release enables you to open up muscles and some fascial adhesions. In addition, factor, great choice. I don't have the tool here, but it's in the other room. It's an instrument-assisted soft tissue technique that will enable you to break up fascia. So it's the saran wrap to the body. Fascia is like your saran wrap, and it holds you together. By loosening it up, your body's now going to take a proper position. Nothing better than breaking up scar tissue and fascia than Factor PM. Big call out to my buddy Todd Riddle. Love doing a work with you. Great job that you're doing, by the way. In addition, exercise rehab. So those core exercises, the rehab. Big shout out to my buddy over at Web Exercise, David Cruz. Does a great job of writing scripts to help people with exercise rehab. You as a professional have to give the patient something. You as a patient need something to do at home. Any questions? I have a whole plethora of core exercises. I'm happy to share a few with you. Just reach out, let me know, share this with some of your friends. In addition to all that, low-level laser. Laser has been shown to help decrease pain and increase range of motion, but help healing at a cellular level. One of my favorite tools that I like to do for low-level laser is Zirconia FX635. Great laser, works great to help the lumbar region heal. Very interesting about lower back. New studies have come out that have shown that there's inflammatory markers in your blood. Blood tests are extraordinarily objective. And so much so, these interleukins are released. Interleukins are subtitles of cytokines, inflammatory markers. Laser is shown to decrease all these different kind of interleukins. So they now are a key component to ascertaining what's going on inside the body, like Inside Out Health, the book. In addition, you also want to functionally look at people. Functional movement screens, are they bending at their lumbar spine? I told you before, you have 28,000 bends at your lumbar spine. So you're bending at your lumbar spine, you're straining your collagen, you're straining your ligaments, you're straining your fibrocartilage at your disc, leading you down to disc herniations. And nutrition. Why nutrition so much? Well, we talked about osteoarthritis being an autoimmune response. We talked about osteoarthritis also being a response to inflammation. Change what you eat. Gluten-free, great choice. Change what you eat, get rid of dairy. Change what you eat, decrease sugar. All these three things are great choices. I just had a patient before and said to me, give me a couple of things to do for my back pain that I can do at home. So I gave her the exercises and I said, change your lifestyle. Don't eat gluten, decrease sugar, and stop frying your food. She looked me straight in the eye. No kidding on this. And she said to me, nobody says this stuff. I think you're the only one who says this. And I'm like, actually, it's very mainstream, gluten-free. You're now in health jail. We got to get you out of jail and we got to get you on an island where you can enjoy your good health. So nutrition, decrease inflammation, other than just changing your diet. What do I recommend? Fish oil is a great choice, omega-3 fish oils. Vitamin D in literature has been shown to decrease chronic lower back pain and acute lower back pain. Phytomulti. All these are out by Metagenics. Phytomulti, a great choice. Phytomultis have been shown with the phytonutrients to increase DNA stability by 52%, lead us down a anti-aging, positive health matter. In addition, probiotics keep our gut strong. 70% of our immune cells are in our gut. And the big guy talked about it at Integrative Health Symposium, the resolution of inflammation. Specialized pro-resolving mediators. They resolve inflammation. They only don't resolve inflammation, they allow for a perfect balance between pro-inflammation, or if you will, initiation inflammation, and the resolution of inflammation. So there's a lot of stuff there. You guys got my whole lower back, and there's more and more and more. John, we got any questions?
Couple questions.
Sure.
Number one, you're standing up, you got a stand-up desk. Why do a lot of people experience lower back pain after standing for a long period of time?
Well, standing's interesting. Obviously, sitting's worse than standing. There's the most pressure on your lower back if you sit. There's even more pressure if you sit and bend, especially bend. You have less standing, but ultimately, if you have some pain in your lower back, standing's the best, but you'll get some pressure from the gravitational pull.
Got it. And on that model, what does sitting for extended periods of time do to your body?
Sitting, this is you. Shutting your muscles off in your lower body. Tightening your hip flexors. Tightening your hip flexors. Your glutes become flaccid. So essentially, it gives you anterior pelvic tilt. It gives you lower cross syndrome. So sitting really has shown to increase health costs, or if I should say, things that occur from sitting, chronic disease. Sitting can include 75% of all chronic diseases because of lack of inactivity. So sitting is the new smoking. Get up and stand, but move like I do.
Last one. When it comes to hernias, why are some people able to move on without feeling it or taking care of it, and others need to have surgery or other options?
Well, there's two kind of hernias, but you're probably talking about the hernia here, not the inguinal hernia. Some aren't that vast in the front, so there's not as much pain. Some rip a little bit more. Clearly, if you have a hernia, primary care physician, general surgeon are the way to go. Hernia obviously is different than a herniated disc, and guys got to be careful post-surgery with a hernia because they rip all the things in here, you definitely want to seek somebody out. You want to break up that adhesions, get a good nutritional protocol, get a little factor in the area, kind of even like when women have C-sections in here, we do a little factor, give him some nutrition, give him some laser to heal. Thumbs up.
Awesome. Where can people find you?
People can find me at 311 North Street in White Plains, Suite G1. Like the Facebook, guys. We're going places. All is good. Dr. Rob, always yours in health.